My name is Sarah Korn, and I'm an upcoming graduate of Valley Career and Technical Center's Practical Nursing Program. For my Capstone experience, I was placed in the Augusta Health Urgent Care in Crozet. At this urgent care location, any patient of any age can be seen and treated, so this can range from infants to elderly. Also in urgent cares, emergency situations can arise and staff is trained on emergency situations for any age range. And in urgent care, it is for people who experience acute illnesses that are not quite emergencies. This can be from strep throat to a broken bone. Also, in urgent care, small procedures can be performed such as splinter removal, laceration repair, and earwax removal. In this specific location, there is only one nurse and one provider. Therefore, when things get busy, things can be hard to juggle. The nurse is responsible for performing intakes on patients as well as assessments. And is also responsible for administering medications that they keep on hand, such as Toradol, albuterol, salmeterol, and epinephrine and diphenhydramine if needed. The nurse is responsible for maintaining adequate supplies in all the rooms for the patient, as well as assisting the provider with procedures if needed. And then sometimes the nurse even has to run stuff to the lab if things get super busy. It's important for the nurse to know important time management skills and prioritization skills for when things get busy. Even though this was a more relaxed urgent care location, at times things still did get crazy. During my time at urgent care, the skills I was able to provide was performing viral testing, such as nose swabs or strep swabs in the throat for bacterial infections. I was also able to perform intramuscular injections, nebulizer treatments, and oral medication administration. At my urgent care experience, I was also able to experience emergency situations for the first time and be able to perform skills such as EKGs, and I was also able to strengthen my clinical skills by observing what acute illnesses look like in patients across the lifespan. One thing I was able to learn during this urgent care experience was the knowledge deficit of the general public concerning acute viral illnesses such as the flu. For example, if a patient comes in and tests positive for the flu and it is within 48 hours of symptoms, then the provider can prescribe something called Tamiflu. However, some patients may not understand that the virus essentially has to run its course, and they may not understand how to treat signs and symptoms of the flu at home and control their fever with over-the-counter drugs, as well as cough and decongestants that they can buy over the counter. This presents a lot in many patients that I did see at my time in urgent care, and I think that is very important to educate these patients before they leave on what proper treatments are, what proper dosages for such as ibuprofen or Tylenol, and how they can best manage their symptoms at home. And then commonly, if this was not explained after the patient left urgent care, then the next day or 2 days later after coming in with the initial flu symptoms, the patient would come back in confused as to why they were still experiencing symptoms. So this is why patient education is very important. The impact that this had on my nursing skills was for me to be able to better manage my time and plan which patients need more care more urgently and what skills I need to perform more urgently for a patient. This is very important because if an emergency situation does arise, then one needs to know how to act fast and help their patients as effectively as possible. The benefit of participating in a capstone experience is so that a student is allowed more freedom with their decision making and patient care with the supervision of their preceptor, who is not an instructor from their school. This also provides for outside feedback of how the student can better improve themselves and what the student does well on from a person that is not directly from the program that the nursing student is in. To me, completing Valley Career and Technical Center's practical nursing program is a big accomplishment at such a young age. Even though this is just a stepping stone in my education and I have many more years of school and many more certifications and licenses to go, I'm very excited, and I feel as if I have a very good foundation for starting my nursing career. I feel as if I've been prepared, and I feel like I am truly became a nurse over the past 18 months.